Hello, everyone, and welcome. I'm Dr. Michael Greger coming to you live from my treadmill. Quick update on my upcoming book, How Not to Age. It is done, or at least the first draft is done, so I have to cut about 500 pages or so. But don't worry, all that juicy stuff will eventually make it into video form eventually. Publication date is still over a year away, December 2023, but hopefully it will be worth it. Today should be super fun, or at least unique. I'm going to try to incorporate a quiz show element to see how well everyone does. But for some housekeeping logistics, as always, as I've mentioned in the last few, Zoom changed their default view such that when videos are playing, you can maximize the video by there's a little gray vertical bar between the video and the panelists, and you can click and drag it over, or you can click on view in the upper right to maximize the video. If at any time you run into any technical difficulties, there are live chat room staff standing by. Let me paste that link for everybody. There we go. And if you're there unable to help, we also have Nutrition Facts staff on board standing by as well, and I will give you that information as well. Okay, please reserve the Q&A button that you see in the Zoom window for content questions. Today's webinar is only 90 minutes, but I've reserved some time for Q&A at the end, but feel free to add questions to the Q&A anytime throughout the webinar, and the Nutrition Facts team will compile them to be answered at the end. You don't have to worry about taking notes or anything. After the webinar is over, we are going to send you a full recording, which I think will be actually really helpful in this case because we're covering a lot of ground, and also a free link to download all the videos in high definition so you can see them in all their full resolution glory. All right. Before I pull up the first quiz, let's lay some groundwork on how to prove whether yoga has special benefits, which is the title of the first video.
The practice of yoga for health has become popular in the United States and worldwide. A 2016 survey estimated that 36 million Americans may be involved in yoga to varying degrees. Though the origins of yoga go back thousands of years, it was only introduced in the United States about a century ago. What are the risks and the benefits? Yoga users tend to report having a better health status, but that doesn't necessarily mean yoga was the cause. For example, yoga practitioners were more likely to be normal weight rather than obese, and that alone could give you better health. Of course, if the yoga was responsible for the weight loss, then that would certainly be to yoga's credit, but yoga users are also more likely to be white, female, young, and college-educated, all of which are independently associated with better health status. The same thing with higher socioeconomic status. Yoga practitioners also tend to exhibit other positive health behaviors, specifically more regular physical activity in general, and a vegetarian diet. And the more yoga people practice, the more likely they were to cut out meat and eat more and more fruits and vegetables. For every additional day per week of yoga practice, the odds of being vegetarian increased 20%. About 1 in 3 yoga teachers surveyed in the UK follow a plant-based diet, much higher than the general population. So when you're doing a study like this, comparing the cardiovascular health of yoga practitioners to runners to sedentary individuals, you can see how difficult it would be to tease out the effects of yoga, when significantly more yogis reported refraining from eating meat compared to the other two groups. It's like when I was reading about the role of yoga in the prevention and management of various cardiovascular diseases. I was so excited to read that yoga could significantly reduce cholesterol levels. After all, heart disease is the #1 killer of men and women. And when I looked at those studies, I got really excited. Reversal of coronary atherosclerosis with yoga? I thought the only lifestyle intervention that could reliably do that was a whole food plant-based diet. Well, What do you think the yoga lifestyle intervention was? A diet packed so full of whole plant foods, fruits, vegetables, whole grains, beans, and nuts, they were getting about 50 grams of fiber a day. No wonder they got heart disease reversal. But what role, if any, did the yoga itself actually play? Now, if yoga gets you to adopt a better lifestyle, stop smoking, eat healthier, great. Whatever gets people to take better care of themselves, right? If your tinfoil hat tells you Martians want you to skip the donuts, I'm all in favor. Whatever it takes. But if we are to tease out whether practicing yoga has any special benefits in and of itself, we really need to look at interventional studies, or randomized controlled trials that go beyond just associations and correlations and can instead prove cause and effect. For example, when we find yoga users have better health status and are less likely to be obese, that could be reverse causation, meaning instead of yoga leading to better health and a normal weight, maybe being in better health, not being obese, is leading to more yoga. Same with the flip side. When you read that yoga practitioners are more likely to have mental health conditions, depression, anxiety, musculoskeletal conditions like arthritis, gout, lupus, fibromyalgia, joint pain, sprains, and asthma, yeah, maybe yoga could be contributing to some of those conditions, like muscle sprains. But for most of these, it's probably reverse causation, right? People with diseases seeking help. Are they getting it? The only way to know for sure is to put it to the test, which we'll explore next.
Okay. So, is yoga good for you? Right? We can't just look at the health of yoga practitioners to summarize, right? Since maybe being healthy in the first place leads to yoga rather than yoga leading you to be healthy, right? Or maybe, look, it goes both ways. I mean, the only way to know for sure is to put it to the test, right? Interventional studies, randomized control studies that go beyond just association and correlation, and instead prove cause and effect. Okay, so the first set of conditions that we're going to look at today are multiple sclerosis, back pain, neck pain, insomnia, and breast cancer. Okay, here we go. Let's try this out here. It's going to be a first for Nutrition Facts webinars. All right. Hopefully everyone now sees a poll before them called multiple sclerosis. All right. Okay. And so first, let's look at multiple sclerosis. Does yoga improve overall quality of life in people with multiple sclerosis? Now, there are three choices, and it's the same three choices for every question that we're going to do today, which is A, is there no benefit to yoga, even compared to doing nothing? B, I mean, it's better than nothing, but about the same as other types of yoga? Or is it C, better than other types of exercise, right? Suggesting special benefit, right? Choose whichever answer you think is best, and then go on to the next question, which is just about physical quality of life, not overall quality, physical quality of life. Then just the psychological quality of life, then sexual function, then cognitive function, and finally fatigue. So fill it out right now, right? Does yoga have no benefit, better than nothing, but like any exercise of similar intensity? Or is there really some special benefits that yoga has for any of these parameters? All right, so given that's the first one, and there's a bunch of questions, I'm going to wait a few seconds just as all the results pour in. Then I'll show the results. Then we'll watch the video to see what the science says, and we'll see who got the questions right. And hopefully this will all go to plan. Again, bear with me. This is the first time we're doing this. Okay. All right. How are we doing here? Okay, so I know you can't see on your end, but I can see results are pouring in. So far I have 500 votes. No, 550 votes. All right. So, God, I mean, I want to kind of wait till they slow down a little bit, but you know, I don't know. We have a lot of conditions. Remember, this is just the first condition, multiple sclerosis. All right. So maybe I'll just kind of cut it off early, see where everybody is, and then move on. All right. So here are the results. Let me share those with everybody. Okay. So it looks like for overall quality of life, 62% said, well, actually, yoga is really good, right? So look at that. 1% said it wouldn't help. 37% said, yeah, but like other exercise, but 62. All right, let's see the next. Physical quality of life, same thing. 60% really thinks that there's some special benefit. Psychological, same thing. Ooh, 81%. Sexual function, ooh, it's a little more split between better than nothing or better. Cognitive function, people are really bullish. Is it bullish or bearish? Bullish on yoga. And same thing for fatigue with MS. All right. So I'm going to stop sharing the poll. Everyone's excited about yoga. Let's see what the science says. Okay. Okay.
Yoga is practiced by millions of Americans and is often recommended as therapy for a variety of medical conditions. But does it work, and for what? In my last video, I talked about how yoga practitioners tend to report better health status, but they also tend to be wealthier, and confounding factors like that make it hard to draw claims about yoga efficacy. For example, when population studies have taken factors like education or income into account, the yoga effects often evaporate. You can't really tell if something is good or bad until you put it to the test. Unfortunately, only about a quarter of the published studies examining the effects of yoga on health or well-being outcomes were randomized controlled trials, and of those, half compared yoga to basically just doing nothing. In that case, if you find benefit, you don't know if it's the yoga itself or whether any kind of exercise would have achieved the same or even better effect. Now look, any kind of physical activity is good, but is there more to yoga than exercise? For example, any kind of exercise, whether low intensity, such as yoga, or high intensity, such as aerobics, may help with menstrual pain compared to not doing anything. In studies on alcoholics, aerobic exercise alleviated depression and anxiety symptoms more than yoga, presumably just because of the greater exercise intensity. Typical yoga is probably best described as a light-intensity physical activity. For example, here's the metabolic equivalents of some typical yoga poses. They average maybe 2 or 3. Compare that to walking at a typical speed, which is about 3. So in general, walking burns about as many calories as yoga, and brisk walking would burn even more. There's all sorts of crazy claims about how so-called hot yoga expends up to like 1,000 calories, but no, you burn about the same calories at room temperature, so 90 minutes would just be more like 300 calories. But isn't yoga so much more than just a workout? Let's see how the data pans out. Multiple sclerosis, for example. We know that exercise can be beneficial in many health conditions, including neurological disorders. And it may not be surprising that yoga, which involves a series of poses, postures, movements, and breathing patterns that could improve balance, muscle strength, and flexibility, should be found beneficial to patients with, say, multiple sclerosis. Let's see if that's actually true. No benefit for overall quality of life, or physical quality of life, or psychological quality of life. Also, no benefit for sexual function or cognitive function, and this was all comparing yoga to doing nothing. A similar failure to find much improvement in quality of life for people living with chronic diseases in general was noted, with only 1 in 7 trials finding a clinically significant benefit. Researchers did find yoga helped fatigue in patients with MS, but not any better than regular exercise.
I am so sorry. I'm so sorry. I was muted. Thankfully, somebody called me. Okay. Whoa. Let's go back. For MS, I'm so sorry. I told you something would go wrong. The correct answers were A, B. All right. Did anyone get A, B? The odds of getting that combo right is less than 1 in 500. So if anyone did, cheers to you. But out of 1,000 people that responded to this poll, only 8 got the first A right, 1A. So I don't know if anyone actually got all those right. But let us move on to the next one, the next poll. Okay, poll number 2, chronic low back pain. Here we go. Here's your chance to redeem yourself. Chronic low back pain. We only got 2 questions here: pain and function. Does yoga have no benefit, better than nothing, but like any other exercise? Or does yoga have special benefit for, in question 1, pain, when it comes to lower back pain, chronic lower back pain? And number 2 is function. And so I'm going to wait till at least like half people have voted. Oh, already half have voted. We already got 500 votes in. So actually, I'm going to end the poll. Sorry for being that quick, but we got a lot to go over. And it looks like we have the same optimism. Oh, I'm sorry. Here we go. Here's sharing the results. Looks like we have the same optimism where most people think the special benefits of yoga for both chronic low back pain, for both pain and function. Let us see what let's roll the tape. Okay, so we're gonna go back to sharing the screen. Oh, sharing this, go back to the video. Okay. All right. And let's go.
Yoga might decrease pain and improve function compared to not really doing anything, but had the same effect on pain and disability as any other exercise or physical therapy. So if you like yoga and want to make that your exercise of choice, great, but it doesn't appear to have any unique benefits for back pain.
Okay. All right, guys, stop the sharing. Okay. So the correct answer was B and B. All right, everyone keeping score? How you doing? All right, so B and B. Looks like 36% were right in both cases. That looks better than nothing, but not necessarily compared to other forms of exercise. All right, next up is insomnia. Okay, this one's easy. 1 question, period. Does it help or not? And if it does, is it better than any other forms of exercise? You are all doing so good at this. I'm so impressed. We have a very tech savvy crowd because boom, we already got 600 votes. Yeah, okay. So, all right, wow, you're good at this now. And people are blunting their optimism a little bit for yoga and insomnia, thinking that, it's just like exercise, nothing, special, but certainly better than not doing anything. All right, so let's see what the study said. Stop sharing that. Back to the video. Okay, here we go. Dun, dun, dun.
Insomnia.
Oh, yeah, did you hear that? It said same for insomnia. Let me back that up a little bit.
Appear to have any unique benefits for back pain. Same with insomnia. Yoga works compared to nothing, but not to physically active controls. And for cancer patients, mostly breast
no, that's okay. This is all part of the same
cancer
thing.
patients, walking was found to be more effective than yoga at improving sleep.
Okay. All right, so I'm gonna stop the sharing. Okay. And so, okay, that was really quick. I know, but the correct answer was another B. Although I will also accept A because of that cancer study, but but okay, B. And so for the first time, most people actually got this right. That's awesome. All right. Now let's get to more breast cancer stuff. Breast cancer. Dun, dun, dun. Okay. Other aspects of breast cancer care, obviously, we got 5 questions, same 3 answer choices. Oh, yeah. Okay. Does yoga help with reduce systematic markers of inflammation? Worse, better, or the same as other exercises? Worse, same, or better than the other exercises. Then there's cancer-related fatigue, overall quality of life, and finally, breast cancer-related lymphedema, which is an abnormal collection of fluid in the arm, chest, or back for which there's no effective treatment. But maybe there is an effective treatment, yoga. Who knows? Let's see what everybody thinks. Okay, this one's going a little slower, obviously, because we got 4 questions. First one, inflammation, then fatigue, cancer-related fatigue, then quality of life, and then lymphedema. All right, things are pouring in. All right. Oh, yeah, no, we're doing good. Okay, gonna end the poll there, and let's see what the results are. Okay, so folks are thinking it's like any other exercise for inflammation and for fatigue and for quality of life. Wow, and so all across the board, it was B, 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 B. Let's see where we are. Okay, we're gonna share screen.
Inflammation in breast cancer survivors. 6 months of yoga had a similar effect as 6 months of non-yoga exercise. Same with cancer-related fatigue and quality of life for women with breast cancer. Better than nothing, but no better than other types of physical activity. Finally, for breast cancer survivors, the effectiveness of yoga interventions in breast cancer-related lymphedema, an abnormal accumulation of fluid for which there's no effective treatment, and adding yoga does not seem to help.
All right, so stop sharing. You can see, we just show what, as a reminder, what everyone said. So the answers were same, nothing. So B, 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 and A, which most people got most of those right. And in fact, like 30% got the last one right as well. All right. Let's move on to neck pain. Oh, this one's easy. 1 question. And this is going to be the final bit of this video before we move on to the next batch of conditions. Yoga is put to the test for chronic non-specific neck pain. Simple question. Is it A, B, or C? And boom, here we go. It looks like B. Although there's still some second choice is C, and then A. Oh, I'm sorry, I didn't share. Here we go. B. About half thought it was B, but people are holding on for C. Let's see what happens.
For which yoga really does appear
let me
to
just
pull
back
ahead
that up a little bit.
For which there's no effective treatment, and adding yoga does not seem to help. There are some conditions for which yoga really does appear to pull ahead of the pack, though. For example, chronic nonspecific neck pain. Based on 10 randomized control trials, not only was yoga better for neck pain than control groups in general, which included doing nothing, yoga also seemed to beat out active controls, other types of exercises. The authors tentatively conclude that yoga can relieve neck pain intensity, improve pain-related disability, increase range of motion, improve quality of life, and boost mood among neck pain sufferers.
Dun, 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 dun. All right. Okay, so to remind everybody, there we go. Out of this batch of conditions, there was actually one thing that yoga seemed to excel at more than just other types of exercise. That's exciting. You can see why I put it at the end. So maybe you could use my emotional roller coaster to make better guesses. But anyway, 39% nailed it, as you can see. All right, next video is entitled Yoga Put to the Test for Headaches, diabetes, osteoarthritis, and older adults. All right, well, before we hit the video, let's jump on to neck pain and excuse me, head pain, headaches, and we got two questions because we have two types of headaches. It's been put to the test against tension headaches and against migraine headaches. Where do you think yoga falls for both of those? Is it like neck pain where yoga really does seem to have unique benefits? Let's find out. Whoa, it's neck and neck. Whoa, neck and neck. Head and head, head to head, head to head. That's funny. Okay, how we doing? Okay, that's good. Wow, it's so close. So I want to get more votes coming in, but all right, let's end it and share it. All right, for tension headaches, people are like, yoga's gonna nail it. But for migraines, it was really split, almost like 33, 33, 33, with just barely ahead, thinking no benefit for migraine. Wow, all right. Let's find out what it said. All right. On to the next video here.
Yoga is an ancient mind-body discipline which originated in India thousands of years ago, and that's where most yoga studies are done to this day. This has raised concerns that national pride might incline Indian researchers to quietly shelve any negative results and just publish studies showing yoga works. This fear is not without precedent. For example, research conducted in China, Japan, Hong Kong, and Taiwan was found to be uniformly favorable to acupuncture. All trials, without exception, were positive. Now, one possible explanation for this finding is that acupuncture is just more effective in countries where it's traditionally practiced, but it is a little suspicious. So are Indian yoga trials more likely to be positive than those from other countries? They looked at hundreds of randomized controlled trials of yoga, both done in India and done in other countries, and trials on yoga conducted in India had about 25 times the odds of reaching positive conclusions as those conducted elsewhere. Again, yes, yoga might be more effective in India than elsewhere, but it is a little suspicious. So for example, if you're interested in whether yoga is helpful for treating headaches, and you read that yoga appears to be helpful for those suffering from tension-type headaches, but then you find out nearly all such studies were conducted in India, what do you do with that information? Also, notably, none of the control groups had any sort of exercise component, though this may be less critical for tension headaches, since neither aerobic exercise training nor strength training appears to help them. So if we're to believe the Indian study conclusions, yoga may indeed help with tension headaches, but even they found no effect for migraines. What may help migraines, though, is other types of exercise, specifically aerobic exercise, decreasing migraine pain intensity, frequency, and duration, at least in the short term.
Okay, so how'd we do here? Back to the results. So for migraines, the second question, the answer is definitely A, no benefit, which most people actually got by a hair. But for the first question, I'll accept basically A, B, or C, depending on what you think of the veracity of those Indian-based trials are. It's kind of a hard question. All right. Diabetes. Oh, this was the easy one. Type 2 diabetes. Next up, does yoga help with blood sugar control in those with type 2 diabetes? You tell me. Well, it's a kind of exercise, so is it just like any other exercise? B, or does it not work, or does it work better? Let's find out. The people are cruising on these. I'm so excited. That I was afraid it would be moving at a snail's pace. Just wait until we get 60% of the, and we're already there. All right, boom. Okay, with 60% of the tally in, most people are thinking it's just like any other exercise, actually. But if it's not, then it probably does nothing versus some special benefit. Let us find out. Okay.
Benefits of yoga practice compared to physical exercise in the management of type 2 diabetes. A significant reduction in both short-term and longer-term blood sugar control was noted in the yoga groups compared to other exercise control groups. However, the findings may need to be interpreted with caution, since nearly half of the studies didn't define and adhere to a well-planned exercise regimen in the control group. Furthermore, an exercise intervention comparable in intensity to yoga was followed only in 3 out of the 8 studies included, and for what it's worth, the majority of the studies, 6 out of 8, were from India. When yoga was carefully compared to sham yoga, which consisted of chair exercises, standing exercises, and slow walking to match the yoga session, the relative yoga benefits evaporated. Both yoga and sham yoga had identical effects on blood sugar status. Hence, further well-controlled randomized trials are required prior to drawing conclusions about the benefits of yoga in comparison to physical exercise in patients with diabetes.
Okay, so this is, this is another toughie, right? Now, I'm leaning towards B in my kind of evaluation based on that carefully controlled study, but one could also argue it for it being C. Yeah, all right. Oh, yeah, so this is how people did. All right, let's move on to knee osteoarthritis. Science is hard, I tell you. Knee osteoarthritis. Here we go. Easy one question. Here we go. Osteoarthritis is osteoarthritis of the knee. Does it improve pain, functioning, and stiffness? So we're going all 3 in 1. Pain, functioning, stiffness in those with osteoarthritis of the knee. Dun, 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 dun. Is this like neck pain? Is yoga gonna shine? What's going on? Oh my God, neck and neck, neck and neck. Oh, it's going to be a close one. All right, here we go. As you can see, people are looking good for knee osteoarthritis, but with a narrow edge on C, thinking we got some unique benefits, but evenly split between B and C. Let's see. I'm going to back it up a teeny bit. Okay.
About the benefits of yoga in comparison to physical exercise in patients with diabetes. Similar tentative conclusions were reached for yoga for osteoarthritis. Put all the studies together, and yoga may indeed be effective for improving pain, function, and stiffness in individuals with osteoarthritis of the knee, compared not only to doing nothing, but compared to other kinds of exercise. They had some issues with the quality of some of the studies, and so only a weak recommendation for the use of yoga for osteoarthritis. But hey, if you like yoga, or if yoga is the only kind of exercise you're willing to do, then probably better than nothing.
Okay. I will accept B or C, B and C, but it does seem to be better than nothing. So I would say A is the wrong answer for the 8% of people that chose it. Okay, now this video closes out with studies on yoga for older individuals. That's defined by individuals 60 and older. 8 questions. All right. We're doing yoga and lower limb strength, yoga and flexibility, yoga and balance, yoga and mobility, yoga and walking speed, yoga and depression, yoga and anxiety, and finally, yoga and perceived mental health in general. Like you ask, they ask people how their mental health is. Whew. Okay, we got lots. All right, how are we doing on time? We're actually doing pretty good. We're doing better on time than I thought we would be. Okay, but boy, we got I think this is the biggest poll we got in the whole thing. So lower limb strength, lower body flexibility, balance, mobility, walking speed, depression. Shout out to Katie, who's actually not on the call, but she's the one that typed in all these the questions and answers. That was a big job. And then we got depression, anxiety, and perceived mental health. Oh my God, everyone's already, we have 60% in on all the questions. Okay, let's see what people thought. I'm curious. Okay, so people are feeling good about yoga for lower limb strength and body flexibility. Come on, 79% say, God, if it's got to work for something, lower body flexibility is going to rock on it, right? Come on. Oh, and balance. 84%, even more excited about yoga for balance and mobility. We're all good. People are a little more skeptical in terms of walking speed, and depression and anxiety. Although actually most people still thought yoga would help with anxiety more than other exercises. And the same thing with mental health. That's interesting to me. Most people think that when it comes to older adults and mental health, yoga is going to be better than just like, walking or other similar activities. Let's find out. Let's finish up the rest of the video. Back it up a little bit. If you like. Oh, is it? No, I don't think it's sharing. Here we go. Share. Okay.
The only kind of exercise you're willing to do, then probably better than
Okay,
nothing.
here we go.
Finally, in this video, let's look at the effects of yoga compared to active and inactive controls, meaning like compared to other exercise regimens or just like doing nothing, on physical function and health-related quality of life in adults aged 60 and older. Compared to doing nothing, they found clear evidence that yoga improves physical function and psychological well-being in older adults, so definitely better than nothing. What about compared to other exercises? Yoga pulled ahead for lower limb strength and lower body flexibility, but for improving balance, mobility, and walking speed, yoga appeared comparable. Psychologically, yoga appeared to beat out other exercises for alleviating depression in older adults, but not anxiety or perceived mental health in general.
Okay. I'll put that back up for anyone who's interested in how people thought. Yoga is the same or better than other exercises in older adults, with yoga really seeming to pull ahead for lower strength and flexibility, as well as depression. And so if anyone picked CCBBBCBB, boom, you nailed it. So that's if you CCBBBCBB. So the 3 C's was lower body strength and flexibility, and the final C was for depression. How I think people got the flexibility one right. Underestimated yoga for the strength. And then I think for depression, you were a little skeptical, but 43% got it right, that yoga actually works better for depression in older adults than other comparable exercises, though not for anxiety. And I think folks thought that that would be the case. Okay. We still got like 7 diseases and a bunch of videos to go, including those on potential adverse effects. So I think I'm actually just going to run straight through the rest, but I do want to know what people think. Let me go to this last poll here. What do you think of the polling? These are kind of little quizzes thing, right? I mean, I think it'd be totally fun to have like elimination rounds and actually like narrow it down and have people win prizes and stuff. But I can also imagine some are just like, just show me the science and forget about all this cutesy frill stuff. Okay, so what do you think? Stupid? Okay, or fun? Let me know so I can plan for future webinars. Where do you think your fellow this is like a meta question. Where do you think your fellow webinar participants are going to land on this question? You know what you're voting for, but what do you think other people are voting for? Stupid okay or fun? And oh wow, we got 70% of the vote in, over 700, and dun 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 dun, most people actually liked it. That makes me really happy. Oh, it wasn't a huge margin, but 52%, most people did think that it was actually kind of fun. We should do more of these in the future. Um, and personally, I'd like to find out how to actually like identify the people who got things right and like narrow it down and actually have like a winners round. And I don't know how to do all that, but it would be actually cool rather than just kind of, oh, I wonder what people think kind of thing. Anyway, but there was a significant percentage, 40% who were like, okay, but it was getting kind of old. And you are the 40% I'm now going to cater to for the rest of this webinar, where we're just going to watch the freaking videos and talk about them and not do any more polling. But I'm glad only 8% were like, this is terrible. Okay. Oh, I'm sorry. I didn't share. Did I not share the results? Sorry, I've been talking about the results. I didn't share them. Here they are. Okay, so most people 52%, and then here's for the 40%. This is what we're gonna do. All right, here's to the 40%.
Should doctors recommend their patients do yoga? As you've seen in my last videos, the difficulties associated with recommending yoga stem from the low quality of scientific evidence available regarding its effects. Oddly, this lack of evidence is partly due to a common failure among researchers to define what they actually study. They just say yoga without defining what they mean. And different types of yoga differ greatly in what they demand in terms of physical strength, depth of meditation, breathing control, and spiritual component. Yet it's very common for reports of studies not to define which type they used. This not only makes it hard to compare results between studies, it also makes it very hard to translate any findings to the bedside when counseling patients. Yoga is broadly defined as a mind-body practice composed of physical postures, breathing techniques, and meditation. And so if researchers say they put yoga to the test, you'd assume all three components would be present. However, some studies use meditation only and call it yoga, with no postures or breathing. Others only examine breathing exercises and call it yoga. Others consider yoga only postures, and still others say they're studying forms of yoga without any of the three components. And so if a study shows no benefit, does that really mean yoga, as commonly practiced, didn't help? And if a study does show benefit, what exactly do you tell patients to do to achieve it? We can take some comfort in the fact that a review entitled "Is One Yoga Style Better Than Another?" attempted to compare the effects of the more than 50 different yoga styles used in hundreds of trials, and they concluded that there was no apparent winner in terms of whether the results turned out positive, so to a certain extent they may be interchangeable. I've talked about the need to have active control to see if there's some benefit to yoga beyond just the exercise component, but such controls may still not deal with confounders such as socialization. Yoga usually involves going to classes, so you can imagine if you were studying the effects of yoga on something like depression. Does breaking routine, getting out, and meeting other people have any effect independent of the yoga? Sadly for depression, yoga doesn't even seem to have a benefit compared to doing nothing. Yoga does appear to be helpful with anxiety, but not for people anxious to the extent that they're actually diagnosed with an anxiety disorder. And all the anxiety benefit from yoga appears to just be from the physical activity, since there appears to be no benefit compared to other types of exercise. So unfortunately, yoga does not appear to be effective for mood and anxiety disorders. A review on the effects of yoga on depressive symptoms in people with mental disorders in general, including conditions like PTSD or schizophrenia, found no significant effect compared to things like social support that offer the same kind of attention, or to doing nothing, but did find an effect compared to so-called wait list controls. See, unlike in studies of drug effects, where a placebo sugar pill is relatively straightforward, selection of a control condition is much more complex for behavioral interventions like yoga. And one common solution is a passive control such as a wait list. Basically, people are randomized to either yoga or onto a wait list where they'll still get yoga but have to wait a while. Now, that's better than having no control group at all, since it still controls for the passage of time, meaning whether or not your condition would have just gotten better naturally on its own, but doesn't really control for the placebo effect. Right? If instead you were just told you were entering a study to see if some exercises may help, and then, unbeknownst to you, randomized to do yoga versus some sort of sham yoga, then you would have the same kind of expectation either way. But if you know going into it you're going to get yoga now, which may help, or yoga in 6 months, and you end up in the wait list control, this may spuriously amplify the difference in treatment effect, because people assigned to the wait list may expect to not get better without active treatment. For example, here's a study for yoga on urinary incontinence. Women were randomized to 6 weeks of yoga or a waitlist control group. After 6 weeks, the incontinence frequency decreased by 70% in the yoga therapy, versus only 13% fewer episodes in the control group. But it's possible that the women in the yoga group reported some benefits due to what's called an expectation bias, because they expected yoga to be helpful. So based on the body of evidence, one might say there's insufficient good quality evidence to judge whether yoga is useful for women with urinary incontinence. Well, what we'd like to see are studies comparing yoga to time and attention control interventions, some alternative to yoga that entail the same amount of time and attention so people don't even know they're in a control group. Now the question arises, who cares if the benefits from a yoga intervention are due to the placebo effect or expectation bias? A benefit is a benefit. As long as people are getting better, who cares? But it would be nice to know if yoga really helps or not, and here we go. Women with urinary incontinence were randomly assigned to a yoga group or to a rigorous time and attention control group involving nonspecific muscle stretching and strengthening exercises. There are two different types of urinary incontinence: urgency incontinence, defined as an involuntary loss of urine associated with a sudden strong desire to urinate, or stress incontinence, where an activity such as sneezing triggers an involuntary leak. 3 months of yoga didn't seem to significantly help overall incontinence, but it did seem to help with stress incontinence, decreasing by an average of 61% in the yoga group, versus only 35% in controls, with no significant changes in urgency incontinence.
Okay, for those of you keeping score, it was yoga is a flop for depression, but at least for anxiety, it may be as good as other kind of exercises, and good for stress incontinence, but not for urinary incontinence. Next up, yoga is put to the test for irritable bowel, inflammatory bowel, hot flashes, and osteoporosis.
Yoga as therapy. When is it helpful? As you've seen over the last few videos, the scientific literature on yoga is limited in scope and quality. I talked about the long list of issues that plague so many of the yoga trials, but let's continue down the list of conditions to get a sense of the best available balance of evidence. For example, yoga as a therapy for irritable bowel syndrome. Evidence from randomized controlled trials found that yoga beat out drugs and was equally effective as moderate-intensity walking, so whichever form of exercise you prefer. What about yoga for inflammatory bowel disease? Since stress can be a trigger, might yoga help? In a trial of yoga as an add-on therapy for adolescents with inflammatory bowel disease, it didn't seem to help at all. But in a trial of yoga versus written self-care advice for adults with ulcerative colitis, 12 weeks of yoga induced a stronger increase in quality of life, and also reduced disease activity even 3 months after the study ended. Here's the graphs for quality of life and disease activity. Now, the so-called self-care group was really just handed a couple general self-care books, so the two treatments, yoga versus self-care, were not matched at all for time intensity, feeling part of a group, or for therapist contact, each of which are likely to have the yoga arm more likely to non-specifically improve their quality of life. So yes, yoga might be effective in improving quality of life in ulcerative colitis, However, the benefits may be no different to other group exercise, for example. Indeed, there have been 11 human studies on the influence of moderate exercise programs upon disease activity and chronic inflammatory bowel disease, and all 11 report benefit in terms of reduced disease activity. Using passive controls doesn't account for expectancy effects, attention given to the study subjects, and the time spent, the investment that the participants put in. Here's an excellent example of why having more active control groups is so important. This details a series of studies on non-pharmacological interventions for menopausal hot flashes. For example, randomized to 8 weeks of acupuncture, 8 weeks of sham acupuncture, or nothing, just usual care. Sham acupuncture is when they still stick needles in you, but shallowly and not in traditional acupuncture points. There was also a study of 10 weeks of yoga classes, or the attention control health and wellness education classes, which lasted just as long as the yoga and were done in the same kind of group social setting. Here's what they found. The hot flashes in the usual care group, the passive control where they didn't do anything special, stayed pretty stable. But the real acupuncture worked way better. But so did the sham acupuncture. Here's the yoga, and here's the health and wellness classes control group. So yoga and acupuncture both worked just as well, but so did the non-yoga and fake acupuncture. There just appeared to be a general placebo effect, such that women in all 5 intervention groups benefited simply by being in a study. That's why it's always better to have the control groups do something, so you can have some confidence at least some of the effect of your intervention is real. But hey, at least they had control groups. This study, 12-minute daily yoga regimen reverses osteoporotic bone loss, caused quite a stir. We know that when it comes to bone health, it's use it or lose it. Exercise early and exercise often. Physical activity is a widely accessible, low-cost, and highly modifiable contributor to bone health. Exercise transmits forces through the skeleton, generating signals that are detected by your bone-building cells. This is why the National Osteoporosis Foundation, the International Osteoporosis Foundation, and other agencies recommend weight-bearing exercises for the prevention of osteoporosis. These include high-impact exercises such as jumping, aerobics, and running, as well as lower-impact exercises such as walking and weight training, to create these mechanical signals that spark bone growth. Lower-impact activities such as yoga are generally not considered bone-building. That's why the results of this study were so surprising. It was a study of internet-recruited volunteers comparing bone mineral density changes before and after yoga. The researchers devised a 12-minute DVD of 12 yoga poses that they believed would stimulate increased bone density in the spine and both parts of the hip. Here are the dozen poses, and they appeared to get benefit in the spine, but not the hip. But in the end, out of the 741 patients recruited at the beginning, only a few dozen actually sent in their bone scans as instructed. So that's only like 5%, right? So they lost 95% of the people that originally started. You can totally imagine how those who got positive results were more likely to send them in, and the others that failed just kind of slunk away. So I don't consider this convincing evidence. Now, the authors had the attitude of, hey, look, so what do you got to lose? The side effects of yoga are all good, so why not give it a try? Well, what you have to lose is the opportunity to do higher-impact exercise that has more decisive evidence of bone benefit. And all the side effects are not necessarily good. There have been vertebral compression fractures associated with yoga. In this series of 9 cases from the Mayo Clinic, they described spinal compression fractures occurring a month to years after initiating yoga-associated spinal flexion exercises. Both scientific and media reports continue to advertise yoga as a bone-protective activity, but there's a need for selectivity in yoga poses in populations at increased fracture risk. Here's the yoga poses they recommend, and these are the ones they encourage people at risk to avoid. And 4 of the 9 patients developed a fracture in a setting of normal or near normal bone mineral density, so maybe everyone should be careful with these. Yoga-related injuries are not uncommon, resulting in thousands of emergency room visits a year, and approximately 5% of those are coming in with fractures. I'll try to put that injury rate in context, comparing yoga to other physical activities, in my final video of the yoga series next.
Okay, so yoga seems around as good as other exercises for IBS and IBD, irritable bowel and inflammatory bowel. Hot flashes appear to be really susceptible to placebo treatments, as both fake acupuncture and fake yoga appears to work as well as the real deals. And can you believe that ridiculous bone study with what sounds like extreme self-selection bias? Right? Then there's the very real concern about spinal compression fractures. Let's dive deep into the potential downsides with my last video, the adverse effects of yoga.
Even though for certain health conditions we have not reached a point where we can say there's good scientific evidence that yoga is beneficial, many patients do seem to benefit. And isn't that what matters? I mean, even in the studies that show the benefit is mainly a placebo effect, does this really matter? I mean, after all, this editorial asserted yoga therapy has never been shown to have adverse effects, but that's simply not true. About 2,000 yoga-related injuries have been seen in hospital emergency rooms every year from 2001 to 2014. Looks like only one fatality has ever been reported in the medical literature, but if you look at the case report, a 16-year-old girl collapsing with a ruptured lung following voluntary mouth-to-mouth yoga breathing exercises with a teenage boy in the hall, that can hardly be characterized as a typical yoga practice. There are tragic, rare cases tied to actual yoga, like this quad rupture in a young woman, or, God, a femoral fracture. The femur is the bone in your thigh, longest, strongest, heaviest bone in the body. Typically, you only see femur fractures with trauma, such as car crashes. But here was just a guy practicing this yoga posture when he heard a large, cracking sound and felt immense pain because, yikes, this is what happened. Now, 2 weeks earlier, he had felt pain in his thigh that he just thought was muscle strain, but bone biopsy showed evidence of previous microfracture, so it sounds like he had been overdoing it, weakening it before the final crack. So I guess the bottom line is that people should listen to their bodies and not push themselves too far. Now, in my last video, I talked about the risk of spinal compression fractures, particularly those with weakened bones, osteopenia, or osteoporosis. Poses causing hyperflexion and hyperextension of the spine should probably be avoided. These were the poses tied to injury in a few dozen cases of musculoskeletal injuries described at the Mayo Clinic. But case reports and series of case reports are really just kind of glorified anecdotes. I mean, they don't give you an overall sense of the safety of yoga. If you look at randomized controlled yoga trials, there's actually no significant difference in injury rates between the yoga groups and the control groups that use some other sort of exercise intervention. Now, this may not necessarily translate out into real-world experience, given the short duration of yoga in these clinical trials, as little as a single day, and the fact that they may be more closely supervised with more highly trained teachers. That's why large-scale surveys like this can be helpful, looking at thousands of people taking yoga classes. Looks like about 30% of yoga class attendees had experienced some type of adverse event, most commonly just something mild like muscle aches, but some individuals did experience more severe events which caused them to stop going. Many causes were associated with overexertion and overdoing, and starting out in poor physical condition. This systematic review included 9 observational studies with 9,000+ yoga practitioners and 9,000+ non-yoga practitioners from the US, Europe, Asia, and Australia. A considerable proportion of yoga practitioners experienced injuries or other adverse events. However, most were mild and transient, and risks were comparable to those of non-yoga practitioners. The risk of yoga-associated injuries was estimated as 1.45 per 1,000 hours of yoga practice, much lower than in higher-impact sports activities such as soccer. Compared to 1.5 for yoga, runners have like 2.5 injuries per 1,000 hours. Soccer, 3.7, 5 for tennis. An hour of yoga is more than 5 times safer than skiing. Here's where yoga falls on the spectrum. Yoga appears much safer, for example, than aerobic funk. On the other hand, yoga practitioners may suffer an increased risk of meniscus injury, the main stabilizing and cushioning cartilage in the knee. Yoga was found associated with significantly higher risk of meniscus injury compared with activities such as badminton, jogging, and climbing hills. Some fundamental yoga postures, like the lotus position, can be hard on the knees. Yes, yoga poses can undoubtedly improve the flexibility of the knee, but immoderate joint movement can pose a serious threat. The bottom line is, like any other type of physical activity, yoga carries a risk of injury. Exercise is indeed medicine, but like any medicine, it must be prescribed appropriately. Many patients rely on their yoga practice for stress reduction, so it's important to be mindful that being injured is the last thing you need. The higher risk yoga poses appear to include headstands, shoulder stands, lotus and half lotus, forward bends, backward bends, and handstands, and so beginners should beware, with particular attention paid to the spine, as this is where the highest numbers of injuries occur. Hot yoga deserves special mention. The extreme heat and intensity of Bikram yoga may make it inappropriate for older adults and people with medical conditions, but there are case reports like this one of sudden cardiac arrest even in a healthy 35-year-old. Pregnancy is an especially vulnerable time for heat exposure, with the increased risk of spinal defects and possibly other birth defects among fetuses exposed to excessive heat. Pregnant women should avoid practicing hot yoga during pregnancy. Maternal hyperthermia, whether from a sauna or electric blankets, had a nearly twofold increased risk of spinal and brain malformations. For example, pregnant women who use hot tubs increase the risk of bearing babies with their intestines outside their bodies or being born without a brain. As any other physical or mental practice, yoga should be practiced carefully under the guidance of a qualified instructor. Beginners should avoid extreme practices such as headstand, lotus position, forceful breathing. Individuals with medical preconditions should work with their physician and yoga teacher to appropriately adapt postures. For example, patients with glaucoma should avoid upside-down positions, and patients with compromised bones should avoid forceful yoga practices. And practices like voluntary vomiting should perhaps be avoided completely. What? It's evidently common practice in traditional yoga.
Okay, so you can see here's a case where you don't actually get the best data from randomized controlled trials. I mean, how else are you going to study 9,000 yoga practitioners and measure results in terms of injuries per thousands of hours of practice? It's just not practical in an interventional study. Bottom line is there are some positions people should consider avoiding, but yoga in general is safer than common higher impact exercise regimens, with the exception of the potential for knee damage. So I would suggest being especially careful with the lotus and half lotus, along with reconsidering headstands, shoulder stands, handstands, and the forward and back bends, forward bend, back bends, that may overly stress the spine. Especially for beginners. And no hot yoga during pregnancy or hot anything. I was surprised about that whole sauna, hot tub, electric blanket data. And try not to puke. All right, Q&A time. Let me just give our Nutrition Facts staff a few minutes to compile the most commonly asked questions, and then I will be right back, and we'll have a good 20 minutes or so to nail down questions. Countdown, please. All right, everybody, let's do your questions. All right. Commonly asked questions have been compiled. 21 minutes. Let's do it. First question, do I recommend any types of yoga or certain websites that teach yoga? That systematic review found that no one type of the 50 types that they looked at seemed to do better than any other type. So no, there's no one type that seemed to pull ahead. And I do not know anything about the websites that teach yoga. There was no studies published in peer-reviewed medical literature for which my reviews are always limited, that talked about different yoga websites. Sometimes, they'll talk about kind of popular websites for things, but there have not been any studies. So sorry, I can't help you there. Next question, does yoga help you age slower? Let's, I'm actually going to pull up my, the first draft of How Not to Age and see what I wrote about yoga. Let me see. Let's find out. I know I have a whole exercise section. Let me see. Find yoga. What do we have for yoga? Okay, I talked about the osteoporosis thing. I talked about the vertebral fractures. Okay, yeah, but what about the good parts of yoga? Let's see. It does not look like it's been tested for effects on any of the 11 aging pathways, which I cover in the book. So does yoga help you age slower? Exercise does. Exercise is one of the most powerful interventions for slowing aging, and so in that case it is. But I did not find anything about yoga in particular, or any special benefits or non-benefits thereof. Could I please summarize the conditions where yoga was helpful, started to lose track? That's why I was saying a recording of today's session is going to be really helpful, because it's like, wait a second, what was it about? What kind of urinary incontinence? I could go back and kind of pick through them all. What was the neck pain worked? What were the other ones? Oh my God, there were just so many, but there were a bunch, maybe a half dozen conditions where it really seemed to pull ahead. But again, most, I think, yeah, I would probably say for most conditions, it was helpful. It was B. The answer was B, right? So is it helpful? Yes, but not necessarily more helpful than other types of exercise. But what I was particularly interested in was there are some conditions, and there were about a half a dozen, where yoga actually was better than just other kind of mild aerobic activity, which is kind of interesting. So, rather than me going through the script, I will just tell people to watch the rerun on fast forward for your condition of choice. Are there any risks of inversion poses? Yes, as I mentioned, these are some of the poses to be concerned about. For example, people with glaucoma, which is excessive pressure inside the eyeball, where we could actually worsen the pressure inside the eyeball with inversion poses, where you do like a headstand or handstand. Yes, the next question, does inversion help brain function? I did not run across any studies on inversion for any kind of cognitive function, or really anything. That's just not something that's been looked at in the literature, so we don't know. Are there any studies related to breathing exercises and their impact on the lungs? One thing that I didn't cover was that, because yoga, I conceive as a combination of different things, like the poses plus the breathing, etc. And so didn't cover the pure breathing, but I did actually do a video about this. In fact, let me paste it in the chat, because I found this video super interesting. And I remember no one else did. Not no one else did, but it was not a very popular video. And I thought it was, and I spent a lot of time on this one video. And I just thought it was so cool, but oh boy. All right. I'm trying to think what the name of it is. There it is. Ha. How to strengthen the mind-body connection. So I talk about all these remarkable benefits to slow breathing, and it seems so silly. Just like, well, what do you mean? Does it just like calm you down or something? No, but slow breathing has this really cool effect on heart rate variability, which is the change in rate of your heart when you breathe out and when you breathe in. You say, why does that have anything to do with anything? And it really does have really interesting consequences. So I'm going to paste that right now in the chat, and I encourage people to check it out. Where are we? Chat. Where's my chat? Oh, there's my chat. Okay, check out this video. Boom. Okay. Yes, there are studies about breathing exercises. Yes, there are benefits, but impact on lungs, that was not looked at. That was part of the question that was asked. Okay. What if I was diagnosed with a bulging disc a few months ago? Well, it depends how bad it is. So I would talk to whomever diagnosed you with what kind of exercises you should be concerned about, because it depends on how bad that disc is looking. Okay, next question. Can a practice of hatha yoga help in reducing cholesterol levels? I don't remember running across that. Oh, yes. Oh, no. Remember that first study talking about reversing heart disease with yoga? But it wasn't the yoga, right? Well, we presume it was just the whole food plant-based diet, right? But dropped LDL, all the amazing stuff, but they put people on a really healthy diet. No wonder. Now, look, maybe yoga played some role in that, but anyway, yeah, that was cool. But in terms of just reducing without changes in diet, let me see if anything pops up. There are some studies. Oh, here we go. There was a Cochrane review, which is kind of like the gold standard for evidence-based medicine, and no evidence for LDL protection. This is what we really care about, which is LDL cholesterol for yoga interventions. So no, you actually have to do the yoga associated plant-based changes. But hey, that's great. Go for it. Okay. Does time of day of practice matter in terms of avoiding yoga injury? That's a great question. Not something that I ever saw put to the test. Poses to regain function of a frozen shoulder. What's the worst poses for causing shoulder tears? Yeah. So no immoderate joint movements. I like how they use that term. But frozen shoulder sucks. I don't know if anyone has a frozen shoulder. So basically, it usually follows some kind of shoulder injury where your shoulder locks up. So basically, your body is super smart, and you kind of overextend or do something bad with your shoulder, and your body is like, you cannot do that. You will lose function of your arm, and then you will die. So it scars up the capsule, the joint. It actually lays down scar tissue to freeze your joint in place for months, to prevent you from using that arm. It's really quite remarkable. And you think, oh my God, this is going to go on forever. I'm never going to be able to use my arm, be able to raise my arm. And then all of a sudden, magically, on the body's own time, months later, it says, all right, you've learned your lesson. Don't be moving pianos anymore. And I'll completely take away the scar tissue and put you back to normal. Absolutely amazing. Now, what people do in that interim, those few months, is physical therapy and heat and all sorts of things. And I remember looking into it. Now things may have changed, but last time I looked into it, which was a few years ago, it didn't seem all the things that they typically tell people to do, we don't have trials showing that it actually accelerates the healing. Thing is, it gets better on its own. It's kind of like wart cures. The reason why there's all these magical wart cures in folk history, like basically anything can make a wart go away, like all sorts of fanciful curses and anti-curses. That's because warts go away on their own. So the witch doctor does something, and then a month later, your wart is gone, and you're like, oh my God, witch doctor is awesome. Same thing with frozen shoulder. It's like, wow, I'm so glad I did that physical therapy because my shoulder got better. Yeah, but we don't have good evidence that your shoulder would have gotten better even a day earlier, because it's actually your body, its own, that's doing it, not the physical therapy. Although maybe that data has changed, but I was really disappointed that we didn't have good data showing actually speeds healing. So what do we do? We just wait till our body heals and don't injure it in the first place. Obviously, that's the best. Okay, where are we? Okay. I'm curious about how these studies were conducted more specifically. Like, what was the duration of practice? That was different in all the different studies. And so usually when we show the paper, when you go back and look at the videos, so the videos would be like really high resolution, so you can blow up the picture. And usually on that first page will be the abstract, and it'll say like the basics. And it'll say, usually say the duration, like how many weeks or months a particular study went on. So if you're like, wow, I love that chronic pain, about the chronic pain, how long were those studies for, or whatever? When should I expect to get that kind of benefit? It depends on the study. You gotta look at those studies. And then of course, when the videos are actually up on NutritionFacts.org, they'll have the sources cited list. So you can just click on it, pull that, download the PDF, and actually read for yourself. Which often, many of these I talked about are meta-analyses and systematic reviews. So it might actually not have average duration in the abstract. You actually have to look, and usually it's a big table listing all the studies and actually says all the durations. And so you can see the ones that worked, that didn't work, and see if there's, you see kind of a correlation between, wow, all the ones that lasted over 4 weeks worked, but all the ones lasted less than 4 weeks didn't work. But that is a important point that you raise. Just because like all the studies on syndrome X show yoga failed to do whatever, failed within the context of the studies that were done. If every single one of those studies was less than 6 months in duration, then all we can really say is not yoga doesn't work, is yoga doesn't work for less than 6 months of yoga doesn't work. But we can't say more than that. And beyond that, this is what's called well, I won't get into fancy statistics terms, but and it's not just timing, but like groups of people, right? We have, there was that the studies done with people, 16 and older. So if there's a study that showed that something worked for X, well, it just showed that it worked for those people in X. And maybe it was only women, maybe it was only men, maybe it was only a certain age group. And so all we can really say, it works for women between ages this and this, because that's all the study actually looked at. So you can really only conclude based on what the available evidence is. Okay, so when I say yoga works, yoga doesn't work, I mean, that's what the best available balance of evidence says. Right? So, but that doesn't mean the best evidence is good evidence, right? Maybe there's just 10 studies and it was only done on for a certain duration and, whatever. But like the best we know based on the available science, this is what was concluded so far. And so that's all what else can we really do, right? Okay. Okay. Any studies on these slow meditative styles of yin or restorative? Are these studies including meditation, which is an important part of yoga? Okay. I guess those are two separate questions. And so, I guess they're kind of similar. So these were not solely meditation studies. I only looked at studies that included some kind of like, so I didn't do like laughter yoga, which is, doesn't really have typical yoga components. I didn't do straight meditation studies without the kind of poses and stuff. So if you want to know what does meditation do, that would be like a different webinar in terms of cognitive health or in terms of mood disorders. I'm trying to think if I have videos already on meditation. I know I have some videos coming up, but they're not out yet. But yeah, that's a separate question. And so if it was a meditation study, it was not covered under all the data I went through in this webinar. Okay. Yoga and the vagus nerve. Is there a possible link? That's what that video was all about. I'm going to post it again. It's probably still my cut and paste. That's the only reason I can do it. There it is. I just did it again. How to strengthen the mind-body connection. It's all about the vagus nerve. Check it out. Okay. Viva Las Vegas. That was bad. Okay. Yoga tends to be connected more to mindfulness practice than other exercises. Any thoughts on this aspect of yoga? Well, the way we'd figure that out is look at studies that just look at mindfulness. And there certainly have been some. It may actually be videos. Oh, let me look. I wonder if I already have them on. Because I know I've looked into it. Mindfulness. Nope. I don't have any studies on mindfulness. Okay, they're coming because I know I wrote them. So yes, there's a large body of literature on mindfulness practice. And I don't know why I didn't do a webinar on it, but they're coming up. Are there any controls for the impact of the meditative aspect of yoga on mental health and general well-being results? Any controls? Right. So I guess this person is asking, like, what components of yoga that when something was better than just regular exercise, like why? Was it because of the meditative component? And we don't know. I mean, they didn't like say, all right, that's interesting. I never saw a study that was like, let's do yoga versus one aspect of yoga, like just poses, no breathing or whatever. Yeah, that would be an interesting study. That was never done as far as I could find. But that's a cool question, right? Because then it's like, well, hey, maybe you just have to do this part and that'll be easier for people. Maybe you get all the benefit or most of the benefit. Or maybe it really is holistic or the whole is bigger than the sum of its parts. Who knows? Okay. What type of yoga is best for someone with peripheral spondylitis and unable to easily get up and down from the floor? That is a great question to ask a yoga practitioner. I'm sure there are all sorts of tweaks that can be made for different poses. If you go to a good yoga practitioner, basically you can be like, this is what I want to work on. These are my abilities. And, they should be, and, this is where I'm injured, and they should be able to custom tailor a program just for you. Next question, what is the best exercise besides yoga for improving, muscle flexibility and function? Prolonged yoga has put pressure on my lower back. This questioner says, causing back pain, I had to stop doing it. So he or she was one of those people that actually had an adverse effect big enough to actually stop. Does light stretching accomplish the same in terms of improving muscle flexibility? Well, some of the studies actually use stretching as a control group. Remember, there was that really good sham yoga study. Did that use, I forget, was that stretching or was that just like sit-ups or something? We'd have to look back at the study, but that's a good question. Yeah. I don't know. We got 1 minute left. All right. So let me jump off and tell you about the next webinar coming up, just so you can get it on your schedule. Next webinar next month, October 7th. Also Friday, 2 p.m. Eastern. It'll be called Should You Supplement with Vitamin K2? Find out in October 7th. Registration opens on September 21st. You can't even register for it yet, but it closes October 5th. And then again, it's on October 7th. If you're interested, so make sure you're signed up for the Nutrition Facts email newsletter for registration details. We'll obviously send out email. Sometimes we send out a second email to remind people that registration is closing. Anyway, thanks so much, everyone, for joining me. Stay safe, be kind, get fully vaccinated, and eat your vegetables.